Hello friends, Dr. Adnan Khan here. If you are a medical student or you belong to a medical profession, you must know the main differences between these things. Psychiatrist, psychologist, illness, sickness, a disease, piles and hemorrhoids. What is the main differences? Don't be confused, I will let you know the main differences between these things. Let's jump on in. First thing is psychiatrist and psychologists. What is the main differences? Number one, psychiatrists are medical doctors while psychologists are not medical doctors. Number two, psychiatrists are MBBS doctor while psychologists are not MBBS doctor. Number three, psychiatrists are expert in three things. Number one, mental disorder. Number two, addiction. Number three, sexual disorder. While psychologists expert in counseling, testing and learning disorder. Number four, psychiatrists can prescribe medicine while psychologists cannot prescribe medicine. Number 5. Psychiatrists do MBBS and then specialize in mental disorder while psychologists can only have BA, MA, MSc or PhD degrees. I hope you understand very well. This is the main differences between psychiatrists and psychologists. Let's move on to the second thing. The second thing is what is the main differences between illness, sickness and a disease. For example, let me clear everything. Illness. If a person experiences chest pain, he presents to you with a chest pain. This chest pain is illness. And this person is fear of heart attack because of chest pain. The fear of heart attack is sickness. And then this person went to a doctor. And the doctor diagnosed this patient with pericarditis. This pericarditis is a disease. I hope you guys understand very well. Let's move on to the third thing. The third thing is what is the main differences between piles and hemorrhoid. Guys, don't be confused. This is the same thing. Piles and hemorrhoid are the same term used for swollen vein in anus and rectum. This is the main differences. I hope you guys understand very well. Let me know in the comment section. Thank you so much.